So here we are, a year later. Leading up to last March 2020, could we really have imagined that our lives would be this dramatically impacted for the course of 12 months? And quite honestly, probably forever. A lot of things happened along the way. And so on March 11th, almost befitting of this hospital in Gainesville, the first patient wasn't from Gainesville, wasn't from Alachua County, was brought in from another state. Makes sense that the flagship hospital of the flagship university of the state of Florida would be serving its need to our country, to be there where others really weren't capable of taking care of COVID patients. A week later, our hospital down in Central Florida saw their first patient. And what started from there was this enormous outpouring of commitment, this quiet, robust, important confidence that people of U of Health were picked on purpose to be here for this calamity and to react to this calamity. And what unfolded in front of us was a series of amazing, breathtaking, and quite honestly, fulfilling things. In-house, creative minds started making masks. In-house, creative minds started thinking about building ventilators. Scientists were trying to figure out the how and the why. They performed air quality tests. They analyzed the data. The clinician scientists started to examine medications and their effectiveness. And what we saw before us was this constant wave of there is work to be done. There are patients who have families. And what started as a focus on inside the hospital quickly captivated our community. And so when we got concerned about reagents, for example, for our lab equipment, the College of Pharmacy was there, thinking about creatively how they could help. When we got into testing, and we did a lot of it, we were on the front edge of testing. And we realized that maybe we should be readying case supplies right now. Well, turns out that 3D printers at the library on campus could help us produce supplies. Who knew? 3D printers. And who knew? Folks not in a health center. And you saw this wave and this thought of tomorrow's going to be better than today. And we're going to keep moving forward. Because as much as it's Florida and as much as people go to the beach and as much as sand shifts under your toes, you still move forward. You take those steps. And as we began to understand that COVID-19 wasn't really going to go away, we began to really focus on what we needed to do, what you needed to do for our patients and their families. There's so many amazing stories. Like the teams on the floors that quickly recognized, maybe one of the first in the country to recognize, that elderly patients with COVID were struggling with delirium. And isn't there a way that we could meet their needs socially, personally, medically? And the teams that focused on being there for our elderly patients were in the moment and realized that they had different roles to play. And as vaccines rolled out, it's no secret that at our Jacksonville campus, the first vaccines were administered in the state. Once again, no surprise, right? U of Health, the flagship medical school, the flagship hospital. We should be first. It's been a struggle for all of you. You've had to deal with this virus. You've had to deal with the patients, the work. You've had to focus on what matters to our patients. And then you go home. And you tackle whatever life brings. Because COVID has impacted your life. Maybe your friends, maybe your family, maybe you personally. If you have children, probably your children. And so for those of you on the front lines, those of you anywhere in the clinical enterprise, you've never had really the chance for an off button, but you've persevered through it. You've helped us get so much more done than we thought we could. And when things got really complicated, when the numbers went so high, you didn't lose focus and you didn't lose balance. You kept doing what was right. And you've seen some tough things. You've watched patients not be able to bring their families completely in. You've watched children scared. It's been tough on all of you. Every day, though, know that there's a legion of people that are thankful for what you've done going forward. And the results are pretty clear. As of early March, 70% of people that live in Alachua County over the age of 65 have been vaccinated. It's because you have health and you have driven this community forward. The list goes on. The science is amazing. The science evolves. The care is wonderful. I think, we all would think, COVID-19 is not going away. We've learned to adapt. You've learned what it takes to put this all on your shoulders and move forward. And in many ways, while we've administratively tried to meet your emotional and work needs, there's more we can and will do. But we need to do it together. Because what remains clear, what will always be clear, you've all been picked to serve at the greatest hospital in the world, to be part of the greatest medical school. All over the state of Florida, all over the country, people look to you to help them. That's never going to change. And you've proven for the last year that that's why you've been picked. That's what you love to do. Thank you. It's been a year of trying times. It's been a year of resilience. It's been a year where I'm fortunate to watch you do great and amazing things for your patients and their families today, for each other as colleagues today, and for what you set forth for tomorrow. You have health isn't amazing because of our name. It's amazing because 14,000 people want to make it happen, and you do great.